Hi, my name is Dr. Joe Gillespie, bringing you the Dental Implant Minute. Really excited today to talk to you about an advancement in implant dentistry. It's called the one-piece implant. What we have with the one-piece implant is an ability for patients to solve one of the bigger problems that we see for a day-to-day care. It's actually a missing tooth. The American Dental Association says 75 million American adults are missing at least one tooth. It's a number that's pretty staggering. So there are a number of problems that come out of missing a tooth. If there's a space there, the neighboring teeth collapse. The opposing tooth, if it's a bottom tooth that's missing, it's called super erupts, but it comes down and can sacrifice itself. So now we get an uneven bite, we get teeth that are moving around, something we would like to control. Traditional dentistry would use a bridge. You'd have to shave down the neighboring teeth next to the space and then lock three teeth together and really hope for the best, because it's hard to clean a bridge and it's hard to floss. You actually can't floss a bridge, so teeth can sometimes have problems later. With this one-piece implant, you're simply going in right in between the neighboring teeth. The implant is very minimally invasive. We numb it, just like we'd have to numb to do a filling, and then the implant is placed. A small pilot hole about the size of a toothpick, and then the implant goes in really with just finger pressure, and then we use a handpiece to finish the job. So the implant's placed very comfortably for the patient, and the honest truth is we can temporize it. We can put a white tooth made of acrylic, called a temporary, the same day we put the implant in. So now the patient gets to walk out. They leave with the tooth in place. It takes us just a couple weeks to make the final crown. So the patient really, we found, doesn't mind because they have a tooth in place, they're biting and they're chewing. But on our end, the lab's working hard behind the scenes to make that perfect final crown. So now really, in one treatment visit, the patient can have the benefit of the tooth, and that second visit, about 3 weeks later, we remove the temporary and we place the final crown in position. That's going to look just like your neighboring teeth, look very natural, the same shade, the same shape, and be easy to clean because the patient can brush, floss in between and manage that space really well. What we love about the one-piece implant is its affordability. It's actually less expensive than any other option that we would have for you in dentistry. We look at the three major ways that you fill a space that are permanent, that are really cemented options. You have a bridge, which is making three crowns, and one sits on top of the space and the other two crowns are attached to the teeth, and that can run somewhere from the $3,000 to mid-$3,000 zone, mattering on what your dentist charges for a crown, because it's just three crowns. So if it's $1,000 a crown and there's three crowns, it's a $3,000 procedure, and that's pretty normal fees. Can also extend much higher to be a $3,500 procedure, and that's retail prices without getting into all of the insurance issues and insurance payments. Some pay some don't. That's just keeping it basic and keeping it retail. When we look at moving to implants, which there are two options to fill a space, it's in my mind the one-piece implant, which is the best of both worlds. You get to place the implant and use it the same day, and then very quickly we move to the final crown. So the fee on that is a two-part system. The implant goes in at $1,600, and the crown that's cemented on top of it, the part that looks like a tooth, is $1,350. So for $2,950, less than the $3,000 mark that we're seeing commonly for bridges, we can fix just the space, just where the tooth needs to go, and not touch either of the neighboring teeth. The nice thing about that one-piece implant, again, brush it, floss it, keep it clean. It's fast, it's really affordable, it is a way to get a tooth in and not harm the neighboring teeth. We call that minimally invasive. To place this implant, we don't have to do a scalpel blade, we don't have to do stitches. You literally walk out of here with the tooth in place. Can't be said for the last of the alternatives, the root form implant or conventional implant. It's a bit wider implant, it has multiple parts to it, and when we look at it from a price perspective, it takes several procedures to get the implant finished. that takes somewhere along a 6-month time period. So now we're placing an implant, very commonly waiting with no tooth for about 6 months, and then attaching other pieces to the implant and finishing it in 7 months. The price point for that ranges. The low end is $4,200 all the way up to, we've seen, $5,500 for a single tooth. So now to put it into perspective, the most affordable, the fastest, the least invasive, and the way to get a tooth in 1 day is the one-piece implant, and we're happy to offer it here to our patients in the area, in Charleston, South Carolina, and particularly Mount Pleasant. This has been Dr. Joe Gillespie with the Dental Implant Minute. You can get in touch with me through email at joedentist@hotmail.com. Happy to answer any questions, or call the office. Speak with Angela or Jana at 843 area code 388-9690. We look forward to hearing from you.